exactly as Stella's mentioned, actually, we have a new national strategy. So that was launched earlier this summer, AHPs Deliver. And hopefully many of you in the room will recognise that infographic. So the new AHPs Deliver strategy, but nationally forward now as AHPs, very much follows on from the legacy that was AHPs Interaction. So, of the strategy, what you'll recognise is the pale blue segments and that bit in the middle, the people first. Those are the new areas of focus, really, that the strategy talks about. There are the ambitions that they set nationally forwards. So people first, not surprising, as is with all contemporary health and social care. Priorities at the moment, it is about people first, and that is about our staff, all of our staff, but of course it's about our patients and the communities that we serve also. Optimising care, thinking about what our HP care will provide. Social justice is a term that they use to think about actually how AHPs can be used to address the health and care inequalities that we know our communities experience. And environmental sustainability, so that's the greener AHP. So we know that many of our AHPs are involved in the things that they do result in sustainable healthcare because of the outcomes that you achieve with your patients and families. But what else can we do? How do we need to think about the services that we arrange, that we procure, that have got sustainability at the heart of those? And last but not least, strengthening and promoting the AHP community. And I think it's really clear from the document, actually. It is an AHP community. It's thinking about what we can achieve collectively as a group of AHPs, but not forgetting the individual contributions of all of our individual professions and the unique skills that we all bring. So they're the new areas of focus, if you will. You'll recognise from the AHPs Interaction, the pink ones around the outside of that. And they are the original foundations, really. They talk about those being the enhanced foundations or the critical enablers that are really going to allow us to work together to achieve those ambitions. And I think we've heard really clearly today, haven't we? Leadership was very much one of these first enablers that we really need to think about. But it's leadership in the guise of actually how diverse and inclusive is our leadership. And I think there's a lot that we need to do in order to think about the diversity of our leadership and how we enable people to step into and onto different roles. We've spoken about AHPs and being in the right place at the right time with the right skill set. And Victoria's spoken to us about the importance of that future workforce supply. But we need to think about what skills is it that we need our new registrants to bring. But equally, what about our existing skill set? And how do we work together to ensure that they are the right skills being delivered at the right time? The commitment to research, innovation and evaluation is as great as ever. And it's been really lovely to listen to the presentations this morning that really put research at the heart of many of your professional updates that we've heard. And it's not only about then creating the evidence base in our individual professions, but using that evidence base to actually drive forward some service redesign. And then the digital and the innovation through data. So again, a couple of years ago, really, we had the AHP digital framework, and the AHPs Deliver really sort of challenges now to think about how are we going to make some progress towards implementing that framework. How will we use digital and data to enhance our services? How will we use AHPs to enhance what the digital offer can be? Not forgetting, of course, the health inequalities that can be created by the extent of digital exclusion. So we must take counsel to that. And all of the foundations and these new areas of focus are very much underpinned by two key themes. So actually anti-racism and co-production, and working together to help us realise the ambitions of AHPs Deliver. As Tabitha and Ella have mentioned, however, Oh, and just another few key messages actually that have really rung out this year. With a real reference to the AHP community, and there's real recognition, hopefully, that you can feel in the room, is it's about all of our AHPs, irrespective of whether we're registrants, students, preceptees, but critically our support workforce also as being our whole AHP community. The leadership, as I've mentioned, really resonates, and it's what we can do to develop that leadership offer and operating at all levels within our professions and across our divisions. Right, so yes, and thinking about the strategy, it's all well and good having a national strategy, and these are absolutely our national drivers. These should be our ambitions. But actually, as employees of this trust, that has to resonate with what we experience in our day-to-day work. So we really wanted to align it instead to our trust strategy. So actually, if we're ever asked, what's your AHP strategy? Our answer is going to be, it's our AHPs Deliver implementation plan. And that's the work that we'd like to do for this afternoon, in a couple of minutes, is actually to sit down, talk to you about the themes of how we're positioning it currently, how do they resonate, and then we can hopefully further distill and define what that implementation plan can be for our trust. So some of our first thoughts then. So we know it's about our people, we can see that in our trust strategy. So our AHP people will be about those excellent pre-reg experiences. And we've already heard from several of the professional advisory groups themselves about what they're really doing to focus on students. And it's more than that. It is those early career fairs, it's those early career conversations about how we attract people to consider our professions that will really then go forward to improve that workforce supply, and then working within our trust in terms of expanding those clinical placement offers with a really good offer that we've got to support our clinical educators to feel well supported to do that well. All of us want rewarding career paths, no matter what our role, and we need to look to think about how we nurture that talent. What are the opportunities to retain a diverse AHP workforce? What can that look like? We've heard about the we've heard about the apprenticeship offer, the return to practice. There are rotations, there are secondments that we can do. There are AHP fellowships that we might invite people to respond to and get involved in work. So how can we use those to retain our workforce? Belonging to an inclusive and anti-racist community, it's imperative that everyone should be able to bring the best of themselves to work. So not only in driving participation in leading to our whole community to consider applying to our careers, what can we do to make people feel valued and working in a trust with us? And again, this link back to evaluation. We are, as staff, we are still members of families, we are recipients of care ourselves. What can we do to ensure that the care that we provide is good, with high quality and is accessible for all? Pivoting through care then, again, it's about this optimisation of care, ensuring that AHP expertise and the research that you're telling us about is absolutely used and aligned to clinical strategy in order to show how we will improve patient outcomes and start to direct our services accordingly. And we know the challenges around our training needs analysis and what the CPD opportunities can be for our whole AHP community. And then progressing on, what does enhanced and advanced practice look like? Are there new roles that our AHPs can be involved in? And we know there are. Our paramedics are in those already, and there's lots of other examples as well. How do we promote those? In terms of our AHP performance, what we want to be able to see is real oversight of professional practice. So where we can support people, our colleagues who may be involved in disciplinaries, where there are staffing issues, it's important that we are involved in understanding those, and HCP referrals. So again, we've got oversight of performance within the trust. We want to see that every AHP has a job plan and that very meaningfully and authentically describes what they do and why they need to do it. Using the digital technology as I've described, and using it to optimise the care and understand what some of the inequalities might be. We've already mentioned about the importance of leadership and that being operating at a directorate level as well in order to drive some of those ambitions. And then lastly as well, in terms of sustainable workforce, so we've heard about how we can be connected both regionally and nationally with our contacts in Health Education England and Health Education England. And how do we strengthen those connections across the system as well? So we need to be doing it within our divisions, but we also need to be doing it within the IPB as well. We know as AHPs that we always involve patients in every step of their journey, but I wonder how well we use our service users to be involved in the crafting and the co-producing of our services. I think there's more that we need to do around that. So again, how can we play a part in that? And then greener AHPs, again, thinking about the sustainability of our offer. Now I'm super conscious of time. The next couple of slides just build on a little bit more about those foundations that I spoke about, those pink foundations. There's 4 slides. On your tables, you've got a pack. I'm afraid it's been well. As always. I won't run through those. They're on your tables anyway. So we either feature right place, right time, Okay, they're basically you'll be able to see these 4 slides: right place, right time, research, innovation, and evaluation, and the digital technology. What I'd like to ask you to do between is for the next 15 minutes, I'd like you to work through one of the grids that is a large A3 piece of paper. It's on your table. And you can see that you've got those focus areas, and then you'll be one of the enhanced foundations. One of the diverse leadership ones. I'd like you to have a little read through the pack and talk amongst yourselves on your table to think about, actually, from what I've said and described, what does that mean to you? And what you could each individually do, but equally what you might be able to do collectively, thinking about leadership or whatever one it is you've got, for instance, around those key focus areas. And 15 minutes, I'll call you back, and then I'd like somebody from each table, please, give me one individual and one collective idea.